Welcome everybody to this week's video where Mabel Eghaghe is going to talk about her role as an advanced nurse practitioner in Parkinson's disease. Mabel is also an associate lecturer at Oxford Brookes University and a dear friend who I've known for many years. I don't know how many years it is now, Mabel. So thank you so much for offering to do this video in your own time.
Thank you, Carol. A pleasure to do this here.
So my first question, I thought it'd be good, Mabel, if you just start with a brief overview of your career to date. So the roles that you've worked since you became a registered nurse.
Yeah, I would say I've been a nurse for over 20-something years now, say about 26 years. And apparently I started from my country, Nigeria, where I trained as a nurse midwife. And I also worked in one of the oil companies, Forde-Johnston oil company, which is the medical department there. I was so fortunate to work in this company because I was exposed to digital literacy from that particular place. So when I came to the UK, it was just like a smooth movement to this digital, the system we use now currently in the UK. While I was in Nigeria, as I told you, I trained as a registered nurse midwife. But back in my country, we do like everything. So we move from department to department every year. So I was so fortunate to work in so many departments, including I did work in the pediatric surgical unit, and that was in one of the teaching hospitals then. And I also work in one of, we say, the biggest maternity hospital in Africa. They used to call it Baby Factory. So I did work there. I worked there as a midwife then, where we just, it's like we call it factory because the way the program, everybody is planned, somebody is taking delivery, somebody is recording, somebody is watching the babies. That's how it is really. And then when I left there, I went to work in this oil company, Shell Petroleum, and from there I moved to the UK. I've been in the UK for the past 15 years. As you will know, coming from Africa, I needed to do this adaptation, which I did in the nursing home in Devon. I always call Devon my home today because that's where I started from in the UK here. Lovely place, really. And where I was there, and the manager there just picked me up to be the nurse educator there. Then I think that's where my education started from. My teaching career really started from. So I became I was the one teaching all the carers. I used to go to one of the NHS hospital, go and do some training, come back and come and practice on the carers there then. And she always said that, I don't think you're going to stay in the nursing home for a long time. You'll be moving to NHS. That's how I found myself. I decided to apply to the NHS after about 2 years. And I have been in Oxford for some time now. And that's where I still work presently. And the journey in the UK has been, I would say, has been very good. I've been so fortunate. I've been supported by people, and like you, Carol, we've known for a very long time. So, and why was I initially worked in the trauma unit, then I moved to the district hospital in where I live now. And from there, that was also in the trauma unit. Where I was in that particular hospital again, I became the diabetes link nurse as well. So I was teaching the nurses about diabetics and any of the new equipment for that comes to the hospital. Then I will go for the training and I will set some days and I will be as a band 5. And I was traveling to do some bank extra shifts at in Oxford, and that's why I got myself to neurosciences. I tell you, I've been there since then. I would say I've been in neuroscience for the past 10 to 15 years now. In neurosciences, I worked as a band 5 initially there, and I was moving, neuroscience there was a massive, big department, and all the neurology, neurosurgery, they were all joined together. And then we used to move daily from any department from one section to the other. So if you say you work in neurosciences in Oxford, then you will be a very, very correct BAM neuroscience nurse because you have the knowledge from neurosurgery and neurology. So as a band 5 there too, I was now doing the diabetic link nurse role. So I used to join the monthly mandatory training. So we used to do the trainings for staff. And from there, the role for practice educator came up. And I applied and I got it. That's really brought me straight into the education line, really, which is almost like my background today. And why from there I decided just I'm not going to talk about my education later. I think we'll get to that later. So while I was there too, as a clinical practice educator, I used to look after all the new students that students coming, locate them to their placement areas, the new starters, even the ones that are moving from the other department to that department. We're organizing study days, lunchtime teaching sections, and induction program. It was quite a very good section we have in our education department. We're well supported by our managers as well. And I think that because you always look at practice and you always look at, you assess risk and then you look for what you can put in place. That made me to do my first leaflet, which I did neuroscience essential, which I think they still use up to today. And there it was such a good one for new starters coming in. There I wrote about what to expect, the pathways, the education programs, and things that they might find difficult, different procedures, and then the trust was just starting with the electronic system then, signposted them to all the things to expect and how to navigate this system. Was quite a good one. And then when I was there, as I said, I was also the Parkinson's link nurse there. So that one just made me to look into a section in neurosciences, and that's where I am today. So when the post came again to move for the Advanced Nurse Practitioner in Parkinson's, I applied for that, and that I got it. So I've been doing that for the past 7 to 8 years now.
Amazing. And you're really going to inspire other people, Mabel, because I suppose as well, you didn't get everything really quickly. You tried lots of different roles, and each role you've gained transferable skills, I would say, from diabetes specialist, your maternity work, etc., and then your education, obviously. So I think the viewers would really like to know what you do specifically as an advanced nurse practitioner in Parkinson's disease.
So the first thing I want to let you know about Parkinson's, so that'll give you a little bit of information about Parkinson's. Parkinson's disease is one of the common neuroscience and degenerative condition. So it's never going to be cured. So it's ongoing condition. So people don't even want to call it a disease anymore. They want to call it movement disorder because it affects their movement. So just giving you that background, just for you to know that we follow them through the disease pathway. So we start normally once they are diagnosed from the consultant, I bring them to my newly diagnosed clinic. And that's because, with that diagnosis, people are so scared. They don't know what to expect. Some of them will say that's the end of their life and all that. So when I bring them to my newly diagnosed clinic, it tends to settle them down. And I decided to do the first leaflet for my trust about the information they need to know and the pathway, what to do and all that. And since that it's been a very good thing. So I make sure that all the consultants, once they are diagnosed, they give them those leaflets. That would let them know when to call us, because some of them, they get the diagnosis and they just out there, they start looking at internet, looking at information from nowhere. So, and they know they can easily call me immediately. I say, yes, maybe I've been diagnosed, then just give them all the necessary support. So it's a holistic care. We follow them through the disease pathway, as I've said. So we run the clinics, and then as the NICE guideline says that all Parkinson's patients should be managed every 6 months by specialists. So the consultant sees them every 6 months, and we see them every 6 months. So in a year, they see 2 specialists twice in a year. So I do the same thing as I would say with the consultant. I'm a nurse prescriber as well. So we see them holistically. We do all the referrals. Then I do run the specialist Parkinson's patient support program as well. So when they can come in with their families, and then different specialists come to talk to them in that program. Then I do run the advanced therapy as well for my trust. And that's we treat them with oral medication. Then there are other specialist pumps. So I titrate them into that. So they come to the day unit, and I titrate them to those medication. So I would say it's a holistic care, really. And then I also, fortunate, really, I do have a home visit as well. So one day in the week, There are so many patients that can come and see me in the hospital, so I book them into my my community clinic as well. So, and those that are in the nursing homes, I may have about 3 or 4 of them in the nursing home. I also see them gently together there. So it's, I would say, we deal with the referrals, MDT referrals to the physios, to the OTs, signpost them to activities that in the community. Just like some of them, they attend the Sing for Parkinson's, yoga, sort of things. We signpost them to it. And then the GP support is massive. So, because as you know, it's a degenerative condition, the problem is that some people think that Parkinson's is difficult to manage. I understand that. The reason being that we as an advanced nurse practitioner, we know the disease, how it presents. So we manage them according to this. So GP's contact is massive with that as well. Then also we do, as I said, training for the staffs and family. I do that a lot. So I run a lot of training programs for the trust as well. And recently I've just developed the e-learning for the trust for Parkinson's as well, which has been so massive. I've been received heavily. Then did a lot of support programs in the intranet, set up the intranet site, so that I believe that knowledge is power. So anything you put in, and it's helped my career really. The more I develop the service, the more less load I get, because people know where to go to for help. So I would say I love it. Always as an advanced practitioner, it's something I like really, because we don't see patients and it ends there, because we follow them through. Some people, when they come to my clinic and they see the way the rapport we have with the patients and their family, it's like you are a member of their family already, because you know them so well. So it's quite a nice one. I always encourage people to go for that advanced practice role if you like it. Yeah. And then again, we work autonomously. That's another big thing. And patient-centered care is the massive. That's all it's all about. Whatever you develop, whatever you do, is all about patient-centered care.
So you've really shown, Mabel, how multifaceted the role is, and it links to those 4 pillars of advanced practice, doesn't it? With your clinical expertise, your education, your leading, and your research as well. So you really sort of underpin all those principles of advanced practice, and I think you're so kind and compassionate as a person, bringing across your person-centered care. And you're the sort of person I would want my mum or dad looking after me, and that role is so key as a bridge between hospital, really, home, nursing homes, and coming into, you're that bridge, aren't you? And I think the role is essential. These advanced nurse practitioner roles are essential. So I know you as a really kind, empathetic, person. You're really person-centered. But is there any specific skills you think that advanced nurse practitioners need, would you say, before to go for the role? What sort of specific skills would you say they need?
As I said before,
just a few.
Very few. I must have said some of them really. So I think you need to be number one. You need to be to want to do the role, to be honest with you, because it's ever evolving role. It doesn't change from one day to the other. So you have to be able to have that compassionate, you have to be able to have that empathy, and you need to know, you want to really support the services that you run. So if you're not supporting the service, it's quite a very big problem. And then you have to be able to manage caseload, So if you're able to manage your caseload, you do very well. So I think it's quite a massive, I don't know, I'm not going to say I'm discouraging anybody, but it's something that you enjoy as you get on. So the skills, number one, education, because we need to learn more. You need to know more, and it doesn't end there, because a lot of treatments are coming up every time. So I normally, we attend a lot of these master classes. Any treatment that come in, you need to be able to have that knowledge as well. And you need to know the particular condition you're looking after. It may not be in Parkinson's, maybe in MND, maybe any other thing that you want to do. So you need to have those skills, like the generic skills, like sometimes because you can always marry other skills that you've used in your career before. Like some patients come to my clinic and I can't do venipuncture. I quickly just take their bloods and all that, So there is a lot of all those skills that come. You bring in your general nursing skills in, and then you add a bit of your managerial skills into the practice, really.
And you've really shown that really with your career journey as well, because some people want an advanced nurse practitioner within 3, they're really ambitious, but actually biding your time, doing those, you've developed your leadership skills, your education, you were doing QI projects, setting up education work, and you really show that how multifaceted, but you've used all of those transferable skills during your career to the culmination of this amazing role that you're really passionate about. Everyone, you wherever you go, you talk to students, newly registered nurses, and you inspire so many people, Mabel. My next question, Mabel, is it sort of links to what you've just said, but with any role, and I ask this of anybody that comes on the channel, really, there are always challenges. So what would you say, you've started to talk about those actually, but what are the main challenges you would say, and how would you overcome them?
Yeah, I think I would say it changes from day to day, really. And then, as I told you, you work autonomously. Yeah. And then you have to you manage a massive patient caseload. So sometimes you find that you need some support from maybe from the secretarial support and all that. But I try not to book. I will always say that one of the things that because it's so massive patients that I have massive patient caseload, and then I need to do all this treatment. So what I have learned from my own side, which is my major challenge, is the workload. So, and then I try not to bring in too many at the same time. That's the only way I can solve that, because I try usually not to book too many patients. Sometimes I have to titrate on apomorphine, I have to titrate on duodopa. So I try to, spread my the time that I have. And then I did ask, sometimes if you are struggling too much too, it's always good to ask for support, like apprentices, like the secretaries. We have the secretaries, we have the administrator. Try to give some of these roles, some of the jobs out for them, like booking the patient. Also, now that I've developed the e-learning, another thing again is that you people in the ward, because I support the ward a lot, so the timing is always there. You have a lot of referrals, you have a lot of from the GP phone calls, and I have from the wards as well. And that's why I always said that when I started from the beginning, I said developing services has really helped me to be able to manage these challenges, really. That's why I decided to do the e-learning for the trust. So now people, when they have problems, they can easily just go and do the e-learning. Then develop the trust Parkinson's website, so people can always go there to get the resources. We are migrating from the old site now to what we call the SharePoint, which is easily accessible. I've developed a lot of leaflets, that can help people, that can help information. So I think the most challenge is the workload, really. But there's nothing you can do about that these days. But you have to be able to prioritize your work and then put services in place that will help your own role. That's why I tell everybody, people, why you've developed this, you've developed this. I said, because anyone I developed helps me. It's always helped me with the pressure of my work, really. So that's usually the challenges. But however, anything we do for this role, for the patients, it always gives you a bit of satisfaction. You feel happy that you've done this, you've been able to sort this problem out one way or the other. But be able to manage your caseload is a major problem. That's the only thing I can say is my challenge.
It's the same with every role, isn't it? Really, with having time to do what you do. It's just a different type of work, but it's about prioritizing, like you're saying, delegating to booking and stuff like that. So, so my next question is: what academic courses and professional qualifications helped you get into your role?
So, as for every advanced nurse practitioner, and the NMC says it must be on master's level. Yeah. So you don't have to have the masters before you go in anyway, because you can always develop in that role. I always tell people that I make sure you look for the particular role that you like most. Because I was so fortunate because I was in neurosciences, so I saw all the conditions, all the different conditions in neurosciences, and I was already a link nurse for Parkinson's already, so I knew where I was going to match, where I was going to specialize on. So the first thing is there are so many courses, you have a lot of support there. You have to start with at least, you must be an registered nurse anyway.
Yeah.
That's the first thing. And then you must be able to do, as I said, it's at master's level, so there are lots of modules that you need to do. Then they always say prescribing. I think prescribing. So, and I personally went to do my master's in advanced practice because I have already got my master's in teaching higher professional education, which made me to be able to teach in the university. But I decided to go and do that because I really wanted to be a prescriber, because it was so important in my role. Everything about my patients is managed with medications. So I decided to go and do that one. So I would say, number one, NMC registration. Then you have to mask out the particular specialties you want to do. And then you must be independent prescribing. And then there are other specialist courses in your own particular area that you do. You can always do that as an added module to add to your particular specialty, because we did neuroscience, because I did BSc neurosciences initially. So, and then I was able to bring some of the modules to add to my advanced nurse practice modules, so to give me all the credits I needed. So I will always say, do a specialist course that is pertaining to that specialist you're going to work in. And there are so many things. If like us, like partners, we have PDUK, they have a lot of them, have a lot of master classes and specialist courses. So I would say just pick on that, because you must, it says you must work in the master's level. So that's why we advise it.
Brilliant. And I think one thing that's really important, Mabel, that you mentioned was that you worked in neurosciences. So in neurosciences, we work in a large NHS trust. We have a lot of different advanced nurse practitioners in that specialism. So if sometimes student nurses or newly registered nurses want to become an advanced nurse practitioner, but they don't know in what area. So you need to really think about that, don't you, when you're looking at going into these roles and talking about being a link role, which you were, you used your education, but you know, you could have gone down any of those advanced nurse practitioner routes, but you gained an interest in patients with Parkinson's disease and linked to our Parkinson's disease team, didn't you, as well, which is amazing. So what top tips have you got? Because obviously I have mostly students and newly registered nurses watching my YouTube videos. What sort of top tips have you got for students or newly registered nurses wishing to become an advanced nurse practitioner?
I think we've said some of them. I said just make sure you specialize in an area that you really love, you want to practice in. Like even when I always tell students really that when I was doing all my studies, whenever I need to do my essay, I pick an area I'm really interested in, and then I research it and I learn more from that. So that made me to be getting good marks in my courses, you know. It's just because I look for an area that you really like most. I will always say the same thing with advanced practice as well. As you said, you can see my journey. I've just been, even as a band 5, I was teaching, then I became the link nurse in advanced practice in Parkinson's, and I just developed on that as well. Even when I was when I was a clinical practice educator, it was the same thing. I was already teaching as a band 5, and I moved on, then became a practice educator. So I think whatever you like most, please just follow that path, you know. And even when I have students, I always say that when you do your placement, look at an area you really love most, so you can put yourself into that area, you know. So another thing is that please do the training. I always believe that education is power. As soon as you know this is what I want to do, it's a matter of just putting one modules at a time, you know. Before you know it, you completed it, you know. I would say even when I was doing my teaching higher professional education masters, I did even do some of the modules that I use in my advanced practice. I added them together. So I would say, please do those courses really. And then as the other point I was going to say is that before you become an advanced practitioner, as I've already said it already, please develop services. As you said, even as you're developing services, you research. You're doing a lot of research, and again, you are doing a lot of auditing. Auditing is part of research anyway. You audit your service and you plan for the next year. You know what you want to do next. So always make sure you do a lot of research. It's so important, and then service development too. And as I've said, it helps you. The service development has really helped me a lot. But finally, I would say it's a very good role. So don't be discouraged. It's always good to specialize in an area. When you specialize in an area, even your patients, when they see you in clinic, they know that they can trust you. They know you know what you're doing. So specialize in an area, learn about that area very well, develop your service very well, and you can flourish in this career. Really, you can.
Amazing, Mabel, and I think that's something you have always done, because you've always been sort of proactive and always wanting to, develop.
Yeah.
I remember when we worked together and I was a lecturer practitioner, and
Yeah.
you were doing your PDN role, your practice development, and you were always looking at the next thing of what can I do? You were really proactive and developing care plans and supporting teaching, and I think that's something that don't wait for it to come to you.
No.
You've got to go out and create those opportunities, which you really did, didn't you? Starting to become a link, and it's education, like you said, education is power. Thank you so much, and I really want to thank you for everything you do in the NHS, because you've been in the NHS for years now, and you're an amazing nurse, an amazing person, and so thank you from everybody for what you're doing with patients as well.
Thank you, Carol. Thanks. It's a pleasure. Thank you so much.
Okay.